Right, good morning to you all. Can you all hear me at the back? First of all, to say then that we're obviously the only non-medics here, so I hope what we have to say is relevant to you. But thank you very much indeed, sincerely, for inviting us to your first conference. I'm going to read the first bit to you, and then I'll just sort of ad-lib as I go along, so hopefully that will do the job. We hope our input today will reaffirm the need for ReSPECT protocol to be implemented by all trusts and administered by all staff in all hospitals and in all health settings, because I think it is important that it's rolled out across the nation. Okay? I'm Susan Daniel, and together with my husband Chris, I'd like to share with you our personal experience of the DNA CPR protocol and procedure following my mum's admittance to University Hospital Coventry in Warwickshire in April 2017. Just a little history then of mum, medical history. My mum's name was Eileen Orange. Medically, she had a stroke in her 70s from which she recovered. She regained her speech. But she was therefore then put onto warfarin for life. She had arrhythmia, and again she was on meds for this. She'd had a gallbladder removed in hospital and recovered from C. difficile. So she was quite used to being in hospitals and always found it a very secure place, always felt that people there would look after her and do the best for her. Other issues, painful arthritis, recurrent cellulitis, and then a bit later on she had pressure sores and was incontinent. But at this point she was still living independently and having quite a happy life, enjoying grandchildren, great grandchildren. In her early 80s she developed Parkinson's disease, and this had a major impact on her life. The medication she was on caused massive hallucinations, and I describe it as her living in a parallel universe really, and at that point I really did feel that I'd lost my mum. It was various other issues, so her quality of life had massively deteriorated. She had a moderate dementia diagnosed at this point as well, but having said that, in another stay in hospital her meds were reduced, and I had my mum back for quite a good while, so a lot of it was linked to the medication. In 2016 she had a hip fracture, and she went in and had an operation which was successful, and it was at that point that the consultant first of all talked about resuscitation, and my immediate response, not knowing a lot about it, was, but I want you to do everything you can for my mum. She's my mum, I'm her only child, I love her dearly, and I want you to do the best for her. And the doctor then explained that resuscitation means, basically in simple terms, that your heart has stopped, you're not breathing, you are dead, and then you are brought back to life. Mum was incapable of signing the form, she was having a blood transfusion and everything prior to the op, so we agreed with it on her behalf. When she came out from hospital, social care were involved. She was in hospital quite a while till the care package was organised, but at that point she had 4 care visits a day to administer medication, to look after her physical needs, hygiene, so forth, and to help prepare meals. And her quality of life had really deteriorated. There was a lot of multi-agency involvement as well, which was quite difficult to sort of link together. We had a very good GP who was designated for mum because of her elderly stage in life, and he called us in together with mum to go through again the do not resuscitation paperwork, and together with mum it was agreed that if the situation arose, and as I said to mum when she was alongside me, it just basically means, Mum, if you've died, the doctors will not bring you back to life. So that was signed and put into place. Easter last year, 2017, on the 16th of April, a carer called me at the 9 o'clock call and said Mum had had a fall. She had had a few, and it was always protocol for her to be checked out. So she was taken by ambulance to the hospital, and we went in to see her in a holding ward in A&E, rather than the normal trolleys in the round thing, which we'd often experienced before. And she was, lying in bed. She was perky. She got some bruising and cuts to her side, but she seemed perfectly well. So that was Easter Sunday. Easter Monday we went back in, and she'd got a very bad sort of chest infection, which I mentioned to the staff, because she'd not had a cold or a cough or anything before she went in. And we know there are problems with Parkinson's to do with the respiratory system. But again, she was sitting up. I gave her a drink, something to eat, and she was fine. We left her. We said, right, we'll be back again tomorrow. Mum probably bring one of our sons with us. And she was chatting away quite, readily. I asked about her breathing in her chest, and she said she'd got a bit of a sore throat, but she wasn't complaining about that at all. So that was Monday evening. So we got home, and we had a phone call about 11:20 at night, and the nurse said, would you please come in, Mum's very poorly. So we went in, and we were taken into a side room where we talked with a consultant and two nurses, and basically they said Mum's had respiratory failure followed by cardiac arrest, and we resuscitated her. And I was just completely shocked, and I remember just saying to the doctor, and feeling really sorry for him afterwards, I just said, but there's a DNR, this is not what we wanted. The doctor said, the consultant said that Mum would probably have another cardiac arrest, and they'd obviously made her comfortable into a side ward. So two nurses, Chloe and Evelyn, and I remember them for the rest of my days. They were so kind and caring. They took us into the side ward, and Evelyn said, I'd put Mum into a new nightie, a pink one, to give her a little bit of colour. And there was Mum lying in the bed. Not technical, so I don't know the technical terms, but some sort of breathing apparatus. And it was very distressing, because normally you couldn't see her breathing, but her chest was like massively, she was gasping for breath, and her chest was rising and falling. And we sat alongside her. We've experienced death a couple of times before with elderly relatives, but when I held Mum's hand, there was absolutely no response whatsoever. We stayed with her all of that evening through till about 7 the next morning, Tuesday morning, and I lifted her eyelids, and they were just absolutely cold and fixed. I was just talking to her, because Evelyn said that that's the last sense that goes, really, hearing. So it was just a really, really distressing situation to be in. And 7 o'clock in the morning, Tuesday morning, the nurse said, I think you need to go home, get some rest, don't worry, we'll call you if we need you. So we went home, we had a quick sleep, we went back, phoned again during the morning, and had a quick sleep, and we went back just after lunch and sat with Mum again. And it was the same situation as the day before, nothing had changed. Around 6 o'clock that evening, Tuesday evening, the consultant came, and he did various checks on Mum, and I'd been asking him things like, can she feel anything? Is she in pain? The sort of questions. And he said, no, we don't think she's in any pain. And he did all the checks, and he said, Mum's unresponsive, and basically that's it. So he I don't know how you do this formally, but the next thing was just a change of shift about 8 o'clock. Somebody came in and gave an injection, and Mum and I think the breathing apparatus had been taken out then, I can't remember. But Mum just swallowed twice, and that was it, she was gone. So it was a very, very peaceful end. How did we feel throughout the experience? Extremely distressed. Because that was my lovely Mum lying there, and I felt, she was sort of almost trapped in her body, and I didn't know if at any level deep within the brain she knew what was going on or could feel anything. frightened. Was she in pain after the resuscitation? Because the GP had said this is not as it is on the TV. You know, it's a very, very invasive procedure. Mum was about 8 stone and very easily bruised and bled with being on the warfarin. So I was like worrying in case she'd felt pain and so forth with the resuscitation itself. And if she was aware at any level in the brain, was she frightened? How did she feel? Confused. You know, why had this happened? Because the form was in the house, the carers knew where it was. Originally we'd had it out on the side, but then I thought that's not a nice thing to have there, the red form, you know, saying you're signing your life away, basically. Well, not signing your life away, but, you know, it's not a nice thing to have on view. But it was shown to the ambulance men, so I couldn't understand why, if it had been shown to the ambulance men, why the hospital didn't know. And I also erroneously thought that everything that the GP had on file on the computerised system would be shared with the hospital, so I thought that the hospital would know this. And I remember I did say to one of the doctors at some point, but isn't it on the system? And he said, well, it should be. And that's no criticism, because throughout the whole process, the doctors and the nurses were absolutely fantastic. And I think it's a process that, you know, mistakes can be made, and for whatever reason, you know, it wasn't there for people to see at the point of need. Guilty. Should I have, you know, made sure that that form was there, or should I have said to somebody, oh, by the way, Mum's got a DNR, you know, albeit that it was only a slight fall that she'd had and it wasn't anything major. We were very worried at one point during the night. You know, is this how Mum's going to be now? Is she going to stay like this? What are we going to do? How are we going to look after her? Is she going to have to go into a care home? Will she stay like this in this sort of, as I describe it, vegetative state? Because she didn't ever want to go into a care home. So that was a real concern for us. I felt extremely sorry for the team that had performed the resuscitation, because it couldn't have been an easy thing for them to do. And then the 2 nurses were there with us afterwards, and they could see how upset we were. And I worry about that doctor going home, and that must have been on his mind, you know. So I do really feel sorry for the team. But on a positive note, I want to say that I was really thankful and forever grateful to the 2 nurses that I've mentioned, Chloe and Evelyn, who talked with us and sat with us. They brought us drinks, they offered us a place to sleep. They reassured me that Mum was not in pain and that she possibly could hear what I was saying to her. They'd made sure that Mum was clean and presentable for us. They took her necklace off and put it around my neck for me. And at the end, when we were leaving the room, when Mum had passed away, Chloe actually said to me, are you all right? And then she said, no, I can see you're not, but she actually gave me a hug. And that is far above what a nurse's duty really is. Her empathy skills are fantastic. So that's my side of the personal story of my mum Eileen. And I'm going to hand over to my husband Chris now to follow on with the DNR process itself. Thank you.
I'm going to split my contribution into 3 brief areas. One's the original issue that Susan shared with you, which is the DNR that took place at Coventry Hospital. A second is a very positive update, really, and it's why we're here today. It's all about the ReSPECT initiative. And third, a very, very brief personal message from Susan and myself, from us as patients and visitors to the NHS, from our perspective as patients and visitors. So the original issue, really, is we're here to share our experience with you. Susan shared the very personal experience, and I'm going to more focus on the process. It was a very difficult, painful, upsetting and distressing experience for all of us. And to iterate what Susan said, we include the doctor and the team that carried out the procedure, and we very much regard it as we're all in this together. It's not an us and you. We aim to highlight the gap between what we thought a do not resuscitate meant and how it worked in this one instance, and we're conscious this is one instance. We wouldn't profess to talk widely, or rather does not work in practice. DNR is a recognition of the wishes of the individual, what they want, what they do not want, and what is right for them. and it's arrived at together in conjunction with health professionals, basically you. The wishes of the individual were recorded on the DNR, Susan said, a form, a piece of paper, following the patient's medical history and after careful consideration from the individual, family members, GPs, doctors and healthcare professionals. And in Eileen Orange's case, all of those criteria were fulfilled. And the DNR order, very clearly stated, will be regarded as indefinite. Eileen's DNR, Susan said, was instigated in February 2016 with a hip fracture, reviewed and endorsed by the GP in June 2016, and as Susan said, Eileen had many issues. Our view was the DNR needs to be and should be visible to all parties throughout this very complex health service we have to ensure they're all aware 24/7. In Eileen's case, the DNR was not visible and the attempted resuscitation was not successful. This did not respect her wishes and caused serious upset and distress for all, and we include again the doctor and the healthcare professionals that were with her. It caused real upset. Our wish is to see improvements made to this process and to ensure that it is both practical, it works for everybody, and is robust. Our specific experience of the DNR process is that it is not. Once the DNR, and I'll now refer to ReSPECT, are in place, it should be visible to all to ensure awareness and to allow the wishes of the individual to be respected. We currently identify, and I'm talking we, the individual patient by their name and unique NHS hospital number to ensure the correct administering of medication, and that data is produced on the patient's wristband. In the 21st century, given the advances in technology and communications, we believe it's within our capability to improve the process and the supporting systems to ensure a practical, effective and robust DNR ReSPECT process. And when we originally spoke at Coventry, our hope is that this capability will be realised. The positive update while we're here today, and we are absolutely so appreciative of having this opportunity to speak to you in person, is the ReSPECT initiative, where not only share our experience, we know these issues would be raised and discuss matters. We very much thank Catherine Baldock for giving us this opportunity. And so we're very pleased to be here today to address a wider audience of healthcare professionals. We are very pleased to see that this issue was already recognised when we raised it with Coventry, and that UHCW Coventry is leading the ReSPECT initiative. It makes us very proud. What we're here to do is really to ask for and urge your personal support for this initiative. We say please seek out, identify and share best practice across the whole NHS. Please adopt a can-do approach and engage with this process. We all want the right outcome for the patient. Please adopt a patient focus and ensure the successful implementation of ReSPECT. It is certainly what I would want. I think it is what we all would want, and it's simply the right thing to do. And if we can close with a personal message that really is from both of us. Patients and visitors do not always get the opportunity to share their experience and views with you, doctors, nurses, support staff, consultants and the NHS team. Our experiences, and if I refer back to Professor Jonathan Wiley's aircraft analogy, we'd probably be classed as frequent flyers and have accumulated an awful lot of points. So we've had lots of experiences, both as patients and visitors. They've been many and varied and largely determined by two key factors: the personal care that you give us and the candour, being open and honest, that you can give us. We'd like to take this opportunity to say to all of you how much you are appreciated and valued, and to say thank you.